Доброго дня, шановні друзі. Дякуємо, що ви
Good afternoon, dear friends. Thank you for coming to this event devoted to the International Week of Immunization. It is not so easy to find reliable information about immunization, especially in general as to the Medicare, but immunization is a factor of the national security. The World Immunization Week was designed to promote the immunization efforts around the globe. And I would like to give the floor to Chief Pediatric Immunologist Fedir Lapiy. Да?
I thank you for invitation. I would like to tell you about the history of Week of Immunization. Firstly, that was the European Week of Immunization. It was introduced by European Bureau and at the organization of the World Health Organization, and then they decided to provide the World Day, to establish the World Day of Immunization. And why do we need this week? We live in a world where we speak about such we do not have vaccination for smallpox now, and young parents do not see coughs, and they do not see lethal instances or deaths from polio as it was in 40s and 50s. And many parents, they didn't suffer from measles and didn't suffer from other dangerous disease. And also there are hepatitis B that take lives of young people, because this disease in its chronic stage leads to damage of liver, and people of 25 or 30 years of age, they need expensive therapy, and they have high risks to die of this disease. And even when this disease is, you can find this disease among some people who suffer from this, and people still ask why this vaccination is needed. And we should speak about vaccination, and we should draw attention to this issue through the media. We have problems with the availability of vaccines, but we have vaccine against hepatitis B, and we have stocks of it for several months. But the children are not vaccinated against this disease, and children can be infected by some syringes that were left by some drug addicts. And why children are not vaccinated against polio, for example? And this vaccine is available in Kyiv, and the number of doses is enough for several months. Also in Kyiv, we have vaccine against measles and other diseases, and in 2015, children couldn't get this vaccine that would provide safety for them. And we speak about the facts that vaccines are available, but children are not protected, because you know that parents, they are responsible for their children until the age of 18. They can accept vaccination or reject vaccination for their kids. And sometimes people just reject this vaccination for their kids, even if the vaccines are available. And we are speaking about the problems with the absence of vaccines. And I'm deeply convinced that our future, the future of our state, is the future of civil society, where the main priority, the main influence should be from the community. The community should demand from the state to get proper vaccination. So the biggest number of votes on the petition in Great Britain, it's about 800,000 people. This is against meningitis. This is the petition on meningitis, and this is the initiative of communities. And we, as civil society, we are on the rise, because if we compare it, we were at initial stages 10 years ago, and they said that we voted and you should provide this for us. And the main idea is that civil society should pressure the state to provide vaccination. We need protection, we need vaccines, and we need to solve our problems. And we delegate these authorities to the state, but the opinion of community should remain the main. And we should be more independent, and we should take responsibility for taking decisions, especially regarding to defend our children from these terrible diseases. And also the problems with registration, procurement, and use of vaccines, and liberalization of the process of vaccinations, and the absence of barriers to vaccinations that exist. They exist in the form of administrative orders, and there should be initiative from the community, from the parents that want to defend their children from those diseases that are in the calendar of vaccines or other diseases, from rotavirus, meningitis, and other dangerous diseases that are in the calendar of vaccination or out of the calendar, but there is efficient vaccines in order to protect our kids and all the children. And also the initiative that comes from the NGOs, People for Vaccination, and other organizations. And I see that this is our future. Otherwise, we can't expect progress in the sphere of protection against infectious diseases. Thank you, Fedir Ivanovich. Fedir Ivanovich stated that vaccination is the most effective way to protect people from infectious diseases. And I would like to state about some figures about the statistic. Due to vaccination, people overcame natural smallpox, and polio decreased 96%. And the global mortality from measles reduced 75%. And sad statistics, more than 1 million children of young age die from infectious disease that could be prevented due to vaccination. And I believe that more information about statistics in the world and in Ukraine can be provided by our colleague. Please, Natalia, you are given the floor.
Доброго дня всім. По-перше, хочу подякувати за можливість бути учасником.
Good afternoon. Thank you for inviting me to this round table. And I think that protection of the children's health is the responsibility of the civil society too. As for vaccination, Fedir Ivanovich mentioned a lot of issues, but I would like to focus on several aspects. First of all, the availability of vaccines, not just availability, but the amount needed for vaccination in line with the calendar and to ensure the continuity without interruption. This means that any mother who decided to protect its child with the vaccine, she should be able to attend the clinic, get a medical certificate that a child is healthy enough to get vaccinated. Currently, mothers, when they come to the polyclinic, they come to the outpatient hospital. They quite often hear that you should come 2, 3, 5 months later when we will have a vaccine. As of today, we are not sure that all the children of proper age are sufficiently vaccinated and sufficiently protected. Another big problem is attitude of the medical community towards protection by vaccination. We carried out a survey. Those pediatrists and family doctors who deal with vaccination, we asked them a question whether the hepatitis B vaccine is alive or not, and the big percentage of them were unable to answer properly. Many parents who come to the outpatient hospitals with their children, they rely on information on pediatrists and whether the pediatrists are able to provide parents with sufficient information. And Fedir Ivanovich today mentioned the issue of social proactivity, that all the parents should believe that it's not their right not to reject from vaccination, but they should believe that this is their full right to require that the vaccination is held. And we should raise awareness among people, raise awareness not just among parents, but also among all the adults. This is actually protection of not just children, but adult population. For adults, we do not even procure the vaccines for inoculation against tetanus. And actually, every 10 years, there should be vaccination against tetanus. So vaccination, it's not just protection of children, it's also protection of adults. Only a combination of of all those factors, we will be able to say that we have the opportunity to control infectious diseases. As for healthcare, in practice, when I speak to parents, I continuously hear the message. They do not believe that children should be immunized, and the second strong message is that they have no confidence in the vaccines which are procured, which are purchased by the Ministry of Health. And that is what Mr. Fedir Lapiy also mentioned. If we come to today's situation, during 2015, the immunization among children under 12 months of age fluctuates between 25.4 up to 63% babies, and this is the about individual protection. During the first year of life, only 26% of children are inoculated against tetanus, diphtheritis and tetanus. While some diseases already started to activate, and in May 2015, one baby of 2 months old died in Dnipropetrovsk because of intensive coughing. Actually, the things, the diseases about which we've forgotten, they come back. Actually, the level of diseases happened to grow during last year among children under 12 months old. Especially this is about coughing, this is about measles, etc., poliomyelitis, and when we do not use the opportunity to protect our children, we should keep all those facts in mind. This event is held on the initiative of the civil society organization Parents for the Vaccination. This civil society organization appeared during the splash of poliomyelitis last year, and I would like to give the floor to Mr. Tymofiy Badikov, head of the NGO Parents for Vaccination. He possesses the latest figures about vaccination in Ukraine. Thank you for your attention. I would like to thank to the Ukrainian Crisis Media Center, which provided a non-profitable NGO with good premises and invited mass media to attend. As a parent, being a parent, I'm very much concerned with the problem of immunization. I am proud that we have many parents here. Quite often in Ukraine, these are only mothers who take care about the health of their children, while fathers believe that they should just earn money, while
І багато з цих людей, котрі
while I believe that fathers should take care about the health of children, while mothers are females who are more emotional. They can become subjects of manipulation of other parents or doctors. And the first message which I would like to deliver, I would like to encourage fathers to take care about the health of their children, because these are not just money with which you can improve the health of your children.
Тому що Всесвітній день імунізації – це дуже теж важлива.
I believe that the World Immunization Day is an important event which attracts attention of medical workers, of parents, to the problem of vaccination. And the objective of this day is to bring together all NGOs dealing with concerned parents for the sake of overcoming infectious diseases. I think that it's a good news for our generation that we have such powerful methods of protection. When we speak about the parents for vaccination NGO,
Дискусія йшла на тему,
so the idea came during the first splash of poliomyelitis in Ukraine last year. We immediately started to think how to overcome the danger of infections, and immediately parents decided to unite their efforts to raise public awareness about the quality of vaccines, the level of protection which could be received via vaccination, etc. That's why on December 25th, here in this room, Rotary Club Ukraine stated that they would invite all the interested persons to join them. In January this year, we officially established our organization and started our work. We organized in many regions of Ukraine roundtables. We delivered lectures at schools. We organized roundtables even in cafes, and we are happy to state that more and more parents join our organization. Speaking about the major directions of our activity, we try to grasp the differences in Ukraine, which distinct us among other countries. So we understood that we needed reliable information, public awareness work, strengthening the national programs for planned immunization, ensure the availability of vaccines, developing capacity of the health care system in general, counteraction to corruption, educational platform in the internet, and R&D in the immunization area. Today, in this room, we have a lawyer who provides assistance to us in terms of anti-corruption actions. This is very general statements, but if to speak specifically, I could describe the photo project to support immunization. We produced promo teasers to support immunization. Due to Fedir Lapiy, we are finalizing the release of important book for parents. This is a book which in much detail, with a lot of pictures, promotes immunization. We decided to engage not just parents into immunization, but also engage children to explain to them what does the vaccination mean. This is a book where you can find a lot of information about vaccination in Ukraine. Thank you. An active member. I just wanted to ask you about that, the most fresh information from the Ministry of Health. For us, it was the first experience. On March 22nd, we applied to Mr. Pereginets, Deputy Minister of Health, and asked him about availability of vaccines in Ukraine, when the vaccines will arrive to Ukraine, and asked all the questions which we get via internet, via Facebook, emails, etc. And yesterday we received the answer. Fedir Lapiy mentioned that we have a vaccine against MMR medicines, against measles, mumps, and rubella. Maybe it will be available for immunization in 2 weeks. Further, we expect Pentaxin vaccines which was purchased by UNDP, and also we received a letter from UNICEF that they plan to supply Ukraine vaccines. Again, MMR vaccine, hepatitis B vaccine, tuberculosis, anti-tuberculosis vaccine, then the tetanus and diphthery vaccine, anatoxic vaccines, rabies vaccine, etc. With this, I would like to give the floor to Yevgen Poltenko, Executive Director of our NGO, who will provide you with full information. Good afternoon, dear friends. I'm happy to see you, and I'm happy to welcome our experts. And once again, I would like to describe that perception of the vaccination among population is very painful. This idea brought all of us together. Our organization, Parents for Vaccination, this is the bottom-up initiative which unites parents who are not indifferent to their children and who are not indifferent to the future of our country. We truly care about this issue, and we decided not to wait for changes, but to become the agents of these changes. And having united in the organization, we hope that our expectations and our strives will find supporters in Ukraine with believe that we should overcome stereotypes as to immunization existing among people. That's why we publish informational materials supporting the idea of vaccination. As of now, this is built more on volunteer investments, on our expertise, on the sponsorship of our time and means, but we believe that this organization will be massively supported by parents. During our meetings, we disseminate the application forms among parents, and each parent may voluntarily join us. We need not just financial resources, but also we need time and people to promote vaccination. The United States government sponsors NGOs at a level of around $1 billion a year. And recently they tried to inspect and to audit those funds and to understand whether this is beneficial for the taxpayers' money. And they understood that if except funding NGOs, the government would commission similar services in the commercial sector, that would be at least 5 times more, that is more than $5 billion. Our objective is to strengthen Ukrainian population, to increase the birth rates, and that's why we expect to have new members, to involve new members. And as for specific fundraising initiatives, we plan to launch fundraising action for publication of this manual, immunization manual for parents, and we expect for support of those parents who care about the future of their children.
And if we do a lot but encounter on information, that would be really difficult. That's why NGO Parents for Vaccination, we struggle with this legally, and we are supported by lawyers. Taras Bezpaly is the lawyer that supports us, and he is going to tell us about the activity and the plans. I will speak Russian, it's easier for me. About the facts we encountered. The Ministry of Health buys vaccines, and NGO tries to inform the citizens why immunization is important. At that, as they say, there is a dark side, dark forces, as in the film, that try to distort this information. The distortion of information is made by manipulation of definitions and provision of wrong information. that do not correspond to reality. And by analyzing the information in the internet, we found out that in the articles where it is said that immunization is important, and when these people, they sign this article, for example, that immunization is important, and there are some really reputable persons and other articles against immunization, and they are not signed at all, or these are just people who are just not specialists in these matters. So the majority do not have enough time. They just look through the information, they find some arguments, and then they provide their own comments, and they say that it is not needed, or, for example, my friend suffered from immunization or vaccination. And then in some cases we should appeal to the courts. These are not comments provided by lay people. We mean that we can appeal against the authors of such articles that are published in the internet, or against the authors who created some video trailers and other things. And the main problem is that we don't know the authors, and we cannot find the defendant in the case. And according to legislation, the responsible are the owners of the site or the editor of the edition, so we can find someone who is responsible. So this information that do not correspond to reality, this information should be removed, and there should be materials presented that will counteract that information that was wrong, because parents should be provided with proper information, and parents should ground their decisions on vaccination of their children based on right information, and how to prepare their children for vaccination. And if they are led by the information that is presented in some sites or TV channels that someone died of vaccination, or some vaccine cannot be used because it was defrozen or something like that, so many parents maybe decide against vaccination. It's easier for them not to do this. And it leads to the fact that, as I remember, we have such term as common immunity and population immunity, and all this level falls, and then the risks go up. And I do not want my children to be in the risk group. And in order to hold this immunity, there should be high percentage of population immunization. And why they do not carry immunization? Maybe because they are lacking in knowledge, and also those pediatricians, they do not know the consequences of such immunization. And parents, when they read about the complications and the diseases that can appear, there is a moment when they read about the immunization against some disease, they see that there are some respiratory problems or other problems, and people sometimes just reject immunization, and this leads to the decrease in population immunization on the whole. And today we hold this press conference, and Pecher's court, there was an appeal to the court on behalf of NGO Parents for Immunization, and we have support and 2 hours ago we received a document with a stamp that the court will hear this case, and we want that the information that was provided on the site, that it should be removed, and they should write rejection, and also parents should be provided with right information and what they should do. Our next task is to minimize those publications with incorrect information and to maximize and provide clear information in the internet and through other media. Thank you. This is a wonderful initiative. It's very pleasant that despite Parents for Vaccination is a new NGO, many parents, mothers especially, joined the initiative, and they help not only by online support, but also they are actively involved in the activities. And here such a mother is present. She is the representative of Rotary organization, Olga Yalovenko. So please tell us about this support and why did you join this initiative? Good afternoon, dear friends. Thank you for this opportunity to have this discussion, and I will outline my position because I'm not from Kyiv, I'm from Cherkasy, so I'm from the regions, not from the capital, and maybe I see this situation in other light, maybe in more at a more grassroots level. And I have 3 children. I have a daughter, she is an adult, she is 19, and I have 2 younger children, 6.5 and 3 years. So I have direct contact with the doctors. So 3 tours of polio vaccination, and also we discussed it with parents and civil society, and I have lack of information, proper information, and I am the member of international organization Rotary, it is called, and one of the activity of this organization is to overcome polio on the scope of our planet. That's why that was the incentive to take part in these processes in our state, because for me this issue is not new, and I am in this matter since 2010, and I also know about the experience of other countries where the situation is more difficult, and there people fight for vaccines, for being vaccinated. They fight for the health of their children, and sometimes they don't have even food. And we have reverse situation. And I will tell you the story from my own experience. I was forced to change kindergarten because the children, it was the private kindergarten, and children were not vaccinated there, and it was believed that my children will be some threat to those children if I will undergo this vaccination. And I was surprised that state kindergartens, they perform their functions, they take this issue under control, and I am, as a mother, I also got involved in this process, and as a person who has an influence at my local level. We shouldn't wait for some good from outside. We shouldn't believe that someone can come and solve all our questions. We should do ourselves. And what can we do? Firstly, we can find information, and we should look for right information. And in Ukraine, there are specialists of different qualification, different level, and there are people that are really concerned of this matter. And we have lawyers, we have doctors, reputable doctors, and people who know IT technology, and we have some charitable organizations and people, and we need support from the media, of course, because as of today, all we have our parents are concerned because they get information from the media, from the internet, and from TV or other sources of information. And I would like to thank those who are here today, because we try to do something at our level. We use our level of confidence and trust among our parents and relatives in order to provide information on what immunization is and how it is important at our grassroots level, and if we are speaking about what we can do for our children and for other parents, because there is category of people that cannot be vaccinated, that's why we should take care of this. And from one side, we try to influence this, and there is also economic effect because of vaccination, and it was calculated. If we are speaking about polio, so the humanity, they will overcome polio till 2020, and humankind will save about $50 billion, and it can then help those people who were infected. And the same thing with other diseases. And what can I say? On the basis of my own experience, we can change things at the grassroots level. We may show that this is really safe to vaccinate our children, and we can influence by our positive responses. And it's not a news for you. If you look at the posts on Facebook, you may see that if the news is bad, it spread fastly. And if the news is good, we try to save our happiness, and many people are not interested in our happiness. That's why please share good news and focus attention on good news. And we can do a lot if we unite. And if we, by our own example, will show that this is not difficult to change the world for the better. And of course, we should live in a good civil society that influences the state, that dictates its needs. And how can state know what we need, these vaccines, if for example, on TV or from other media, they say that vaccines are not good, or they are procured in the wrong way, or there are some manipulation, or different sorts of this. So this is my position. Thank you, Olga.
We mentioned several times that one of the major directions in the work of our NGO is meeting with parents and public awareness work with involvement of best experts. And I would like to invite Sergey Andriyash, committee member of the NGO Parents for Vaccination. Dear parents, thank you very much for joining us today. Everything in the world is going around information, and keeping in mind the situation in our country, we decided that one of our top priorities will be public awareness work. In this context, all around Ukraine, we organize meetings of parents with the experts in vaccination. Not all medical workers are experts in vaccination. That's why we invite real experts to these meetings. During such meetings, parents have an opportunity to ask questions to the experts and to get full, professional, and reliable information. Based on the results of that meetings, many parents who hesitated to vaccinate their children, they became convinced supporters of vaccination. The benefit of such meetings And the advantage of them is that those parents whom we convinced during such meeting, they become also the agents of support to vaccinations, and they are able to convince their relatives and friends that vaccination is needed. We have held 10 such meetings in Kyiv, Irpin, Chernivtsi, Черкаси, in Lviv, and we plan in nearest future to have such meetings in Dnipropetrovsk, Zhytomyr, and Ternopil. That's why I encourage everybody to disseminate this information about meetings with experts on vaccination. Come to our meetings, invite your friends to share reliable information, which is so much needed in our society. I would like to thank very much to those experts who cooperate with us, who devote their spare time, they devote energy, efforts to our joint activities, and I'm especially grateful to Mr. Fedir Lapiy, who always readily accepts our invitations. Our next such expert gathering will be tomorrow in Zhytomyr, and we invite you cordially to come. We are very grateful to all those experts who contributed so much efforts to strengthening the immunization in Ukraine. And we would like to use today's opportunity to award the special thanks on behalf of our organization. Mr. Fedir Badikov will award the most proactive experts with all this thanks on behalf of us.
Наталії Вінник теж хочемо подякувати, що вона, ми нові, молоді, імунність нації, вона вже...
Unfortunately, there is no input to the mic. We cannot hear and cannot translate. No sound. Thank you very much. We invite all the conscientious parents to join us, and we have a small video, promoting video.
За вакцинацію.
Я знаю, що мої діти захищені. Я за вакцинацію.
Я за здорову націю. Я за вакцинацію.
Я хочу, щоб в Україні було майбутнє. Я за вакцинацію.
Я бережу здоров'я своєї дитини. Я за вакцинацію.
Я хочу, щоб всі діти були здорові.
Я за вакцинацію!
Це батьки, які
These were parents who joined our organization. We invite you to join us, and we are very grateful to all the mass media for dissemination of this information. I also would like to invite you to look at this logo. There is the symbol. There is an umbrella and family behind that umbrella. What does this umbrella mean? This means protection to Ukraine and to our children. This is a very clear symbol, and please help us to disseminate this information. Help us to disseminate this information among all the families in Ukraine. Thank you. I would like to add some information. What Natalia mentioned. I mentioned the barriers, the education of medical workers. This could not be resolved within one day. Parents look for information.
Якість подачі інформації, нам ще треба дуже багато вчитися.
The quality of communication also is important. That's why we should use all the educational channels to spread the information, right information about vaccination. When we speak about the resources which could be involved, the only possible resource is to contact those who are against and to communicate with them. My experience, Natalka experience, your experience of communication with parents, medical workers speaking in their medical language, which is not understandable for parents. I think that such messages coming from different sources, they will continue to come, and I will try to support vaccination. There were several attempts to create the internet resources. I think this latest attempt, the most successful attempt, the parents can access it, can find information about the schedule of vaccination, can find those diseases which could be prevented via vaccinations, and can develop the individual calendar of vaccination. This is rather reliable source of information. That is what I wanted to mention as barriers in about liberalization. We have procedure and we have to stick with this procedure. But if we wish to join Europe, and I really support this strive, we should keep in mind then in Latvia, Lithuania, Estonia, in France, there are no double registration, and the France uses lab control of the producer. This makes products more accessible. The problems which we have today in Ukraine, these are internal legislative moments. If we wish to move towards civilized work, we should overcome these barriers. Also, medical workers should be the main source of information for the patients, and patients should be provided you with information that each 10 years you should be vaccinated against diphtheritis and tetanus, or you should be vaccinated against coughing. You might be also vaccinated against flu, or when you come to the pediatrist and you try to get vaccinated against varicella, against rotavirus, and some other diseases. We need to have a procedure in place when you come and request for such an operation. When a pediatrist, when a parent wishes to come to request a vaccination against varicella. We should be able to allow parents to vaccinate their children on their own account. We should overcome these barriers to make vaccination more accessible for children, for parents. Thank you, Fedir Ivanovich. I would like to quote Fedir Ivanovich, who mentioned that parents should be partners of professional experts, professional doctors, and now parents and pediatrists and doctors got united. We hope that the mass media will join us now. If you have any questions, you're welcome.
Good afternoon, Radio Liberty. So in the framework of this immunization week, whether there are any polio campaigns or the information of vaccination or data, how many children were vaccinated or percentage of this kid. So additional tour vaccination, you mean, right? We ask Fedir Ivanovich. This is not official statistics, but I can say that the week of vaccination continues. And as I know, I didn't see official information, but at the Minister of Health, a briefing will be held tomorrow about the round of vaccination and the situation on polio. And this is all in the framework of the week of immunization. And here is the parallel event that coincided in time. And we can also think about different conspirology theories, but every 3 months, monitoring mission comes to Ukraine in order to see how the measures are implemented to overcome the outbreak in Ukraine. And for 2 months, for several weeks, the mission was active here in Ukraine. And I believe that tomorrow there will be some information provided as to those outputs that were reached in overcoming the outbreak of polio in Ukraine. So I would like to add about the activity of our organization. We prepared today's event, and we carry out some events in the region this week. We continue it throughout April, and in March, we also carried out some events. This were all volunteer events, and active parents are involved who support this, and we help them, and we tell them how to get some facilities where they can educate people. And also in Zhytomyr, there will be an event tomorrow. And also we are planning to create some paint books, and we plan to paint Children's Hospital, the pediatric department of the hospital. We wanted to paint, make some payments there because the repair works are on the way there. And also we appealed to the court. We plan to organize a flash mob, and we plan different activities to disseminate information, to share information that was provided to us by World Health Organization. There is a lot of information, many materials that we spread through the internet. And what can mass media do? We go to Gramatsky radio, and then we will answer some questions that they will ask. So the main idea that I didn't mention before is that we should have vaccines in Ukraine, and pharmaceutical companies should support us, those who create these vaccines. and they should view us as a reliable partner. We mean Ukraine as a reliable partner, and they should cooperate with us. We should work like partners. Of course, governments change and political situation changes, but we should have strategic storage stock of vaccines that is constantly renewed. And if something happened, for example, with the supplier, and they cannot bring vaccines in time, it shouldn't influence the situation with vaccination and had no detrimental effect on vaccination on the whole. Because this is like a special attitude, people should understand that vaccination is important. People have had habit to be vaccinated, and now some people try to get rid of this habit, but we should renew this habit, and everything will be okay. The second question was about statistics on polio. You already mentioned some figures. I can tell you about the figures of 2015, children up to a year of age. They should get 3 polio, and the level 64% approximately. And we need 90–95% of vaccination. We should reach this percentage. And I would like to add some information. We are also the members of the Committee on Polio in Ukraine. And according to the results of the third round, there were publicly accessible data about 83, 81, and 3.3%. And this information was at the end of February, when the third round was officially over. And this vaccine, it was in polyclinics till the end of March and till 15th or 17th of April. And we had some meetings with our partners, and this percentage rose. Last week, there was a meeting with this mission that verify Ukraine on fighting polio, and there is positive assessment of this work. We do a lot of work in this respect, and the official results will be seen. And
what mass media also can communicate to people, they can engage the audience into its own survey. The official statistics, it contains some mistakes or errors. Quite often, parents state that their children are vaccinated while children are not vaccinated. It's very important for everybody to understand the responsibility. Let us ensure the reliability of information about those children who are really vaccinated. We carried out a lot of surveys among pregnant mothers, about those people who assigned to our information in Facebook, and amount and about 500 parents who we questioned whether 83.3% of parents stated that they vaccinated their children. They said yes. in anti-poliomyelitis, 61% of parents vaccinated. We decided to carry out this survey by ourselves, having gathered a bag of prizes to those to those surveys. People are not very eager to answer this question. So if you organize such service via telephone, via website, live, etc., please provide us with the statistics. We will compare it with what we have, and we will understand the situation. When we try to get some grants and we are able to provide and to back up such application for grant with official statistics, which is not reliable. Quite often parents in official situations are afraid to provide reliable information, to say truth. Further questions? Veronica Septim, Kyiv TV channel, you mentioned that we have sufficient amount of vaccines for scheduled vaccines. I will explain. The scheduled vaccination in Ukraine is against 10 diseases. As for Kyiv, out of that 10, we have against hepatitis B MMR vaccine, and against poliomyelitis to start vaccinations. We have the inactivated poliomyelitis vaccine. In the nearest future, during next month, we expect to get vaccine against tuberculosis, also pentaxin, this is against coughing, tetanus, diphtheritis, and also poliomyelitis. We will get these vaccines in June or maybe in July. As of today, we have 5 vaccines out of 10 diseases which are in our schedule of vaccination. The rubella vaccine, anti-rubella vaccine, is already in Ukraine. It was never used in vaccination, but since this is a new procedure, it will take some time. That is what I wanted to ask about 5-component vaccine, which is designed for the first 12 months of age children, for the babies. The most optimistic prediction when it will become available, this will be by late July. What parents have to do before that time? I have no answer to this question. This is rather painful question. I would like to point out to the issue of procurement and supplies of this vaccines. 3 weeks ago, the working group on the list of vaccines which will be procured for this year. Now we are in late April of 2016. So the procedure is long and cumbersome. First, we need to compile the list, then collect data from the regions, then submit application or procurement order. That is, we lacked those vaccines in 2015. This year we lack also these vaccines. It's difficult to understand how many vaccines we need this year, last year, etc. And quite often parents rejected to vaccinate their children because they do not have no confidence in vaccines. The lawyer explained about manipulation with information. As of today, immunoprevention is very much manipulated with from 2011. But here we need to have state policy towards vaccination. It's not the issue of the personal attitude of the minister to vaccination. There should be the matter of policy, of state policy. If you do not know the target of your journey, you would never reach your goal. And today we have an excellent team. We know what our goal is, and we wish all the best. I would add on behalf of the parents. Last year and this year, UNICEF and parents carried out a huge task, raising public awareness. But quite often UNICEF is ignored by some Kyiv experts. Parents should encourage those medical workers to raise their skills.
Требують курси. Ну, якщо я хочу, щоб мої подопічні
My grandmother worked in the hospital until the age of 72 years, and she quite often attended the upgrading courses in Kyiv. Parents can shame those pediatrics who are insufficiently educated in the sphere of immunization. Also, we shall prevent politicians to interfere into the issues related to children's health.
Раз, і ці події собі як в плюсик, да, підняли політичний. Це не та річ, яка потрібна собі якісь поінти. Да. І от батьки повинні не, якщо бачать, що політики
When parents observe that politicians speculate on the vaccination issue, they should not listen. On behalf of the parents, I would like to add a couple of words. When we speak about vaccination, it always comes to certification. Vaccination against poliomyelitis is supplied with thermal sensors, and it's easier to control. But I do not think that parents should be should not be involved at this stage. This is one of the objectives of our organization. The vaccines should be quality vaccines, and we will control this issue, supervise this issue. But as of today, all the immunal medicines, all the immunal vaccines are under very sorrowful control and supervision. There are not so many producers in the world, and there are a lot of countries buying those vaccines. What parents can do if the vaccines are not accessible, are not available, they should be united and state that they wish to be vaccinated. Those who wish not to be vaccinated, they state this loudly. So those who who wish to be vaccinated, they also should be united and state this loudly. Sometimes the vaccine is available, but parents do not come. So we have to check whether vaccine is available and whether we wish to be vaccinated. By July, we have to raise the level of interest in new 5-component vaccine to ensure that they will come and vaccinate their children. Moreover, parents have to wait until arrival of this vaccine. It should come, and children should be vaccinated immediately. The situation with the polio vaccine, we were able to vaccinate children with 3-valent vaccine, and by April 18th it was possible to do. No further questions. Thank you very much. I would like to remind you David Solberry's work that not each medical worker is an expert in vaccination. Thank you, everybody.